7 days from now, you wake up, walk into your bathroom, check your blood pressure, and for the first time in years, the number is lower. Not because you changed your medication, not because you suddenly started extreme workouts, but because you made a few specific changes that directly affect how your body controls pressure from within. I am Dr. Kevin, and over the past 20 years working with men over 50, I've seen the same pattern repeat itself again and again. Patients follow their prescriptions, their numbers improve slightly, but the real shift only happens when they address the biological systems medication alone does not reach. I've watched people return to their doctors and have their medication reduced not because they asked, but because their numbers made it impossible to justify the same dosage. In this video, I am going to show you exactly what those individuals did differently. But there's something important you need to know before we go deeper. Later in this video, I will reveal 3 common things that may already be part of your daily routine, quietly working against everything you are trying to fix. If you miss that, you lose a major part of the benefit. So stay with me, because what you are about to learn connects directly to how your body regulates pressure at its core. Let's start with something most people have never been clearly told. Inside your arteries, there is a naturally produced gas called nitric oxide. It acts as your body's built-in regulator, signaling the muscles around your blood vessels to relax and expand. When those vessels relax, blood flows with less resistance and pressure drops naturally. The problem is that after the age of 50, your body produces significantly less of this compound, and most conventional approaches to blood pressure focus on controlling the outcome, not restoring this underlying mechanism. This is where everything begins to shift. The foods you were about to learn about don't just lower numbers, they interact with this nitric oxide pathway directly. Some increase its production, some protect it from being destroyed, and others activate the enzymes responsible for creating it. This is not guesswork. This is biology, and once you understand that, your approach changes from managing pressure to influencing the system that controls it. The first food works almost like a direct signal to your arteries. Beet juice contains one of the highest concentrations of dietary nitrates found in any natural source. When you consume it, those nitrates travel to your mouth, where specific bacteria begin converting them into nitrites. That transformation continues inside your bloodstream, where those compounds become active nitric oxide. And when that happens, your blood vessels respond immediately. They relax, widen, and allow blood to flow more easily. Studies have shown that even a single serving can produce measurable changes within hours. But consistency is where the real impact comes in. The practical approach is simple: drink a small glass each morning, not ice cold, because temperature affects how efficiently the process works in your mouth. If the taste feels strong, you can dilute it slightly, but the key is maintaining the habit daily. Over time, this creates a steady increase in nitric oxide availability, which directly supports lower pressure without forcing the system. Now here, something most people overlook completely. There's another food that works through the same nitrate pathway as beet juice, but with an added advantage. Arugula. It not only supports nitric oxide production, but also delivers a key mineral your body depends on: potassium. Potassium plays a critical role in how your kidneys handle sodium. When potassium intake is adequate, your body signals the kidneys to release excess sodium instead of holding on to it. And that matters because sodium retention increases fluid volume in your bloodstream, which directly increases pressure. This creates a simple but powerful balance. More potassium means less retained sodium, and less sodium means less pressure inside your vessels. The most effective way to use this is raw, not cooked, because heat reduces both nitrate and mineral effectiveness. A handful added to a meal daily is enough to begin shifting that balance. Now let me ask you something most people never consider. What if there was a natural drink that worked through the same mechanism as a class of prescription blood pressure medications? Not similar, actually similar at a biochemical level. Hibiscus tea contains compounds that interact with the same enzyme targeted by ACE inhibitor medications. That enzyme controls a hormone responsible for tightening your blood vessels. By reducing its activity, hibiscus allows those vessels to stay more relaxed. This is why regular intake has been shown to produce measurable reductions in pressure over time. The method is simple: steep it properly and consume it consistently. But there's an important detail here. If you are already on medication that works through this pathway, combining both effects can amplify the result. That doesn't mean avoid it. It means be aware and involve your doctor in the process, because when natural and medical approaches align, the outcome becomes stronger than either one alone. Now let us talk about something almost everyone uses, but very few use correctly: garlic. You've heard it. It's good for your heart, but the benefit depends entirely on how you prepare it. When you crush or chop a garlic clove, a chemical reaction begins. An enzyme activates and converts compounds into a powerful active molecule that directly supports blood vessel relaxation. But here's where most people go wrong. They cook it immediately. Heat destroys that enzyme almost instantly. That means you get the flavor, but you lose most of the cardiovascular benefit. The correct method is simple but critical. Crush or finely chop 1 or 2 cloves, then wait at least 10 minutes before consuming it. That waiting period allows the full conversion to take place. Once that is done, you can eat it raw or mix it into food. This small timing change transforms garlic from a simple ingredient into a functional support for your vascular system. The next food does tea work instantly, but it produces one of the strongest long-term effects: ground flaxseed. Clinical studies have shown that a consistent intake over several months can significantly reduce blood pressure levels. And the reason is not a single mechanism, but several working together. It supports reduction in inflammation, improves the condition of your blood vessels, and positively influences your gut microbiome, which is now known to play a role in cardiovascular health. But there's one important detail: whole flaxseed does not work the same way. Your body cannot fully access its active compounds unless the seed is ground. The practical approach is simple. Add 2 tablespoons of ground flaxseed to your daily routine, whether in yogurt, a smoothie, or oatmeal. It's easy to include, and over time, it creates a measurable shift in how your body regulates pressure from within. Now here is one that surprises most people: dark chocolate, not as a treat, but as a targeted tool. When the cocoa content is high enough, it contains compounds that activate an enzyme inside your artery walls. That enzyme is responsible for producing nitric oxide internally. This is different from the nitrate pathway we discussed earlier. Instead of supplying raw materials, it activates your body's own production system. That means you are now supporting nitric oxide through multiple independent pathways at the same time. But the key is quality and quantity. It must be high in cocoa with minimal sugar, and the amount matters. Small, consistent intake is what produces the benefit. This is not about excess. It's about precision. Used correctly, it becomes part of a system that reinforces your body as natural ability to regulate pressure. Now we come to something most people completely overlook: protection. Nitric oxide is powerful, but it's also fragile. It can be destroyed before it even reaches your blood vessels if your body is under high oxidative stress. That means you could be doing everything right, eating the right foods, and still not getting the full benefit. This is where pomegranate comes in. It contains compounds that specifically protect nitric oxide from being broken down. Think of it as a shield. Instead of just increasing production, it ensures that what your body creates actually reaches its target. When you combine production and protection, the effect becomes much stronger. This is why adding a small amount of pure pomegranate juice daily can significantly enhance the impact of everything else you're doing. Now at this point, everything we've covered works together as a system. But here is the problem. For many people, even when they apply all of this, the results don't reach their full potential. Not because the approach does tea work, but because something else is interfering. And this is where we need to shift your attention. There are a few things that may already be part of your daily routine, things you don't. Think twice about that quietly disrupt the very mechanisms we've just built. They don't feel harmful. They are not labeled as dangerous, but biologically, they work in the opposite direction. And unless you address them, they can cancel out a significant portion of your progress. This next section is where most people have their biggest realization, because once you see it, you can unsee it. And more importantly, you can correct it. Now here is the first thing that surprises almost everyone: your mouthwash. It sounds completely unrelated to blood pressure, but the connection is very real. Earlier, we talked about how nitrates from foods like beet juice and arugula are converted into nitric oxide through bacteria in your mouth. Those bacteria are essential. They are not harmful. They are part of the process. But when you use antibacterial mouthwash regularly, especially twice a day, you eliminate those bacteria. And when that happens, you interrupt the entire pathway. That means even if you are consuming the right foods, your body cannot convert them efficiently into nitric oxide. The result is simple: you lose a significant portion of the benefit. The solution is not complicated. You don't need to stop oral hygiene. You just need to avoid antibacterial products that destroy beneficial bacteria. This is a small adjustment, but it restores a critical part of the system. The second issue is something most people do every single morning without thinking about it: breakfast. Specifically, high refined carbohydrate meals. Foods like white bread, sugary cereals, and processed options create a rapid spike in blood sugar. In response, your body releases insulin. And insulin has a secondary effect that most people are never told about. It signals your kidneys to retain sodium instead of releasing it. When sodium is retained, your body holds more water. That increases blood volume, and increased volume means increased pressure. This is one of the reasons blood pressure spikes are most common in the morning hours. The solution is not extreme dieting. It is simply shifting your first meal toward foods that do not trigger that spike. Protein and healthy fats create a completely different response in your body. That single change can reduce one of the biggest daily triggers of pressure elevation. Now, the third factor is something many people rely on regularly without realizing its effect. Pain medication, particularly certain common types used for joint or muscle discomfort. These medications interfere with your body's natural ability to regulate fluid and blood vessel function. They can cause your body to retain sodium and water, and at the same time reduce the effectiveness of certain blood pressure treatments. That means even if you were following the protocol, you may be partially undoing your progress without realizing it. This is not about stopping anything abruptly. It is about awareness. If you are using these medications frequently, it becomes a conversation you need to have with your doctor, because once you understand the interaction, you can make better decisions about how to manage both pain and pressure effectively. Now let's connect everything to one specific moment in your day, the morning hours. Between early morning and mid-morning, your body naturally releases stress hormones that raise your blood pressure. This is a normal biological process, but it also means this is the time when your system is under the most strain. And statistically, this is when the highest number of cardiovascular events occur. That makes your morning routine extremely important. What you eat, what you drink, and what your body has available at that moment determines whether that natural spike becomes dangerous or stays controlled. This is where everything we've discussed starts to work together. When you consume nitrate-rich foods early in the day, your body has the raw materials it needs exactly when pressure is rising. When you avoid high insulin spikes in the morning, you prevent additional fluid retention during that same window. And when you preserve the bacteria in your mouth, you allow the entire conversion process to happen efficiently. This is not random advice. It is a coordinated system designed to influence your body at the exact moment it needs support the most. Most people don't fail because the information does the work. They fail because they apply it partially. They choose one or two changes and ignore the rest. But the body does operate in isolated parts. These mechanisms are connected. When one is supported and another is disrupted, the result becomes inconsistent. That is why some people feel like they are trying everything but not seeing results. The missing piece is not effort. It is alignment. When all parts of the system move in the same direction, the outcome becomes predictable. Now, it's important to understand something clearly. This approach is not a replacement for your medication. It works alongside it. Medication manages the result of your blood pressure reading. What we are doing here is influencing the system that creates that result. When both are working together, the effect becomes stronger. And in many cases, that is when doctors begin adjusting treatment because the numbers improve beyond what medication alone would produce. When this system is applied consistently, the changes are not just in numbers. Circulation improves. Energy levels often shift. The body begins functioning more efficiently. These are subtle changes at first, but over time, they become noticeable. And more importantly, they become stable. Instead of constant fluctuation, you start seeing consistency. That consistency is what signals real progress, not temporary control. At this point, the decision becomes simple. You can continue focusing only on managing the number, or you can begin supporting the system behind it. The information is not complicated. The actions are not extreme, but the consistency is what determines the outcome. And that is where most people either move forward or stay exactly where they are. So here is the takeaway. This is not about one food, one habit, or one change. It's about understanding how your body actually regulates pressure and working with that system instead of against it. If this made sense to you, then you are already ahead of most people who never look beyond the surface. Take one step today. Not everything at once, just one. Because once you start, the rest becomes easier. And if you want to go deeper into how mineral balance affects everything we discussed, check the next video. It builds directly on what you've learned here.